Hi, my name is Meg Fraser. I am a member of the HFSA Communications Committee. We've selected your presentation from the 2019 meeting as being one of the important topics that we'd like to discuss. Please share who you are, your role at your institution.
Yeah, my name is Dr. Rebecca Cogswell. I'm the Medical Director of Mechanical Circulatory Support at the University of Minnesota.
If you could please summarize your talk and give us some important points.
Yeah, so I was asked to talk about the unique psychosocial challenges that are presented when caring for the left ventricular assist device population. I think what we're discovering more and more as we formalize our psychosocial evaluation, that patients who are considered high risk or who have psychosocial needs going into LVAD may not have an increase in mortality, but they do see higher hospitalization rates, and I think we as a community are going to have to decide what to do with that information.
And please share with us what you have learned in your past experiences.
Yeah, I think one of the things that I did for this talk was to sort of look at the burden of work that's seen on teams. Overall, we know that the surgeons sort of arrive and put the LVAD implant in, and one of the things that I did for the survey, for this talk that we're going to be sharing tomorrow, is presenting survey results that we did across the country from LVAD coordinators and social workers and surgeons and heart failure cardiologists, just trying to define what is a successful LVAD. If we decide as a community that having a few years on LVAD support, even if the patient didn't do everything perfectly, maybe didn't have their INR monitored, but had a few more years with their children, that was a successful LVAD, we have to be willing to support our care coordinators and our social workers towards that end. And the other thing that I am thinking about as we're approaching LVAD patients is that whatever psychosocial needs they had prior to their LVAD, they're going to have the same psychosocial needs, if not more, afterwards, but the resources available to help them actually shrink because they have a left ventricular assist device, and many of our mental health services, as well as our substance abuse treatment programs, et cetera, are not available to those patients.
Any other lessons you'd like to impart on heart failure providers?
Yeah, I mean, I think what I've learned overall in thinking about this is that we have to be mindful of our team. We are asking our care coordinators and our social workers and our LVAD coordinators to solve nearly impossible problems, and there's a real balancing act there in terms of caring for this population while not burning out our team. And when I sort of get into the burnout with a team, it's not that they don't want to help the patients, it's that we are being asked for them to solve nearly impossible problems with no resources. And so I think we need to be mindful of our team, but we also need to advocate for more resources on our teams and also in the community to support these patients. The other thing I sort of want to close with is that this is not black and white. I am glad we continue to struggle with this as we're talking about life-saving therapy. And whenever we're having these heated discussions in our team, I think we need to pause for a moment and say, why are we here, and not lose sight of that? What is our mission?
Thank you, Dr. Cogswell.
Yeah.